Good evening, everyone. Let me welcome all my viewers once again today on Heart Mitra. It's always a pleasure to be connecting with you for these live programs. Not only we post content for you on a daily basis so that you are aware about the latest things happening in the cardiovascular space and you are aware about them, but also for you, we invite leading doctors from across the country who can talk to you directly and talk as a friend and answer the queries also you have in mind. Today, I am very glad to welcome Dr. Sanjay Polwal from the city of Belgaum. Sir, welcome to the program.
Yeah, good evening, Mr. Mehra. Good evening to all viewers on Heart Mitra. I'm Dr. Sanjay Porwal. I'm a professor and head of cardiology at KL University, Belgium. Have an experience of more than 30 years in treating heart diseases and more so with diabetic and heart disease as well. I'll be happy to answer all the queries and whatever best I can contribute to the education of everybody at large. I will try my best. So, Mr. Mehra, thanks to this platform. Let's go live on this. Uh,
Thank you for taking out your time today. So we get a lot of chats, and questions from our viewers on specific things. And today we will be talking about this topic, which is protecting heart in people who have diabetes. And you being a cardiologist and a professor of cardiology, I think no one better than you to answer some of these queries. But for larger audiences of ours, before I start taking your questions, let me, give a formal introduction of sir to all of you. As he himself shared with you, he's one of the leading cardiologists of our country and based at Belgaum. He is professor and head and the Department of Cardiology at KLE Academy of Higher Education. And he is also a fellow of all important national and international academic bodies related to cardiology. And he has many research publications to his credit, and he has also participated in many international trials. So we know that we are talking to a leading cardiologist today who can answer the queries for us. Sir, to begin with, let me invite you straight away and share, and if you can share for our viewers that how are these two things connected, especially diabetes and the cardiovascular disease. If you can provide us a brief overview between the relationship of this and why people with diabetes, they should be paying attention to their cardiac health specifically.
yes, this is one of the most important aspects as far as we come across. See, me being a cardiologist, people do come to us with heart-related issues. Uh, of the 100 heart patients which come to me, maybe blood pressure patients, uncontrolled blood pressure patients, or maybe people with heart attack, angina. So whatever heart attack, of the 100 people, almost 40 to 50% are diabetics. Internationally, this figure is 25%, but amongst Indians, it is close to 40 to 50%. Now, Indians, especially Asians in general, and Indians in particular, are more prone to this kind of diabetic heart. What we say is the diabetic heart. So, how this is that most of the people, almost 40 to 50% of the heart patients have diabetes. Now, diabetic patients have a more severe heart disease. They have more severe blocks. They have more longer blocks. Their arteries, as compared to non-diabetics, are more narrower. And diabetes just not affects the heart, the arteries of the heart. It affects the arteries elsewhere as well. Say brain, kidney, legs. People having leg pain, when they start walking, they get tired. The leg starts hurting. This is called as uh, foot claudication because of the blocks in the leg arteries. It is just not the heart. Then you have something called as strokes. This is because of the plaques, or what we say, blockages in the brain arteries. Then you have in the kidneys also, the kidney function deteriorates because of the blockages in the arteries of the kidney. The eyes, the vision diminishes. That is because of the affection of diabetes and blockages in the arteries of the eyes. So diabetes is a multi-system disease. It just does not affect the heart. It affects the kidney, the eyes, the brain, and the arteries else across the body. So moreover, we see a magnified level of atherosclerosis or clot formation or block formation or cholesterol block formation in the arteries across the body. So that is why diabetic people are more important, as far as they have to the care for, or the heart health is important, because of the severity of the disease. Not only that, it is equivalent, being a diabetic alone is, the risk factor is equivalent to having a previous heart attack. So a nutshell, every diabetic needs to take care of their heart for the following reasons which I enumerated. We will talk about it as in when we move forward again.
Yeah. No, thank you, Dr. Porwal, for setting in the context. And I think as he shares with our viewers, it's very, very clear that there is a strong correlation between diabetes and the cardiovascular health. And almost 50% of people who come with the cardiac diseases, they have diabetes as well. And I think what he mentions is very important to understand that if in diabetic patients it's even more intense, the cardiac disease. So one needs to be very, very careful. So when we look the other way around, now let's say there's a person who is having diabetes. So is it like 100% chances that he will eventually have a cardiovascular disease as well, of some intensity, or there are some specific or a higher risk group of people who will eventually have a cardiovascular disease also?
See, the which diabetic develops a heart disease is an enigma. Not all diabetics will have a when they have also is an enigma. Nobody knows when it is. It is an interplay between the control of your diabetes and your genetic predisposition for getting a heart disease. Being a diabetic magnifies your chances of getting a heart disease because you are a diabetic. It multiplies because you are already genetically predisposed to this. Now, by and large, if your HbA1c is not controlled, say more than 7, in that case, you are more likely, I'm not saying you will get, but you are more likely to get a heart disease or a heart attack or an angina, or the blocks are magnified in them as compared to non-diabetics. Again, one is poorly controlled diabetes, physical inactivity, because your heart is not accustomed to the strenuous activities. So when you know do not access have an if you have a sedentary lifestyle, your heart is not accustomed to excess strenuous, I mean, any external pressures which the heart cannot handle. If suddenly the heart is, say, exposed to a insult, maybe physical insult or a mental insult or an emotional insult, your heart has to be ready and capable to handle that extra stress. If being a diabetic, if you are not accustomed to that, your the ill effects of those diabetes will magnify here, and your propensity to get a heart attack is much more. What we call in terms of medical terms is plaque rupture. Your plaque rupture will be higher in those people who are not accustomed to a routine physical activity, which I say should be at least 150 minutes a week, 30 minutes every day of a brisk walking at least. This is what is I'm saying, at least. This is how it is.
Okay. So, which means that, it depends on what kind of blood sugar levels you maintain and how well you are controlled. That will have a lot of impact on how quickly or, when you will pick up the cardiovascular disease. So now we clearly understand that, these people are at risk. So what should people do? Are there any early signs and symptoms which one should be looking out for, which tells him that okay, he's going towards the cardiac disease and be more careful?
See, generally, what happens, the normal symptoms are chest pain. The very essence of heart disease is chest pain or pain. The pain sensibility in diabetics is underplayed. People who are diabetics, more so uncontrolled diabetics, they are not very susceptible to pain as a symptom. So you have the so-called as atypical presentations of heart. Normal patients, non-diabetic, generally say I have a heart pain, I mean, then he goes to a here you don't get a heart pain, you get atypical symptoms. See, you are walking a few kilometers, Now of late you are walking, by in walking 3 kilometers you are comfortable. Now in walking 2 kilometers you are having a discomfort. What is that discomfort? You are feeling short of breath, you are getting tired early, you will get an interscapular behind in the back pain, you get back jaw pain, you get pain in the abdomen, around the arms. They are all atypical symptoms. It need not be central. The common myth is you have a left-sided chest pain is a heart pain. Wrong. It could be right-sided as well. It could be between your shoulder blades as well. It could be between the back also. It can come to the jaw. People have gone to dentist to say I have a tooth pain, and unfortunately he turned out to be a heart attack patient. So these are the so-called atypical symptoms. Pain is generally not very severe in diabetics because of their uncontrolled diabetes and their affection on the pain receptors. So these are the atypical symptoms. So when should a patient consult a cardiologist? When should a diabetic should consult a cardiologist? Now here the algorithm is straight. If symptoms, whatsoever symptoms, as I enumerated these atypical symptoms, people walking comfortable, any activity comfortably doing, of late not able to do the same activity as comfortable as I was doing before, go to a cardiologist. If this patient person and any person, irrespective of the symptoms, once a year you have to go to a cardiologist to get your basic cardiovascular or heart health done, which is the essence of this heart mitra program. Get your basic ECG done, your echocardiogram done, and your treadmill done. What each does is echocardiogram tells you the electrical activity of the heart, whether your heart function is fine. Then why it is important in diabetics, painless heart attacks are also commonly known. So to detect that, you have to get an echocardiogram done. The You need not have pain. Diabetes can affect your the muscle of the heart as well, what you called as the cardiomyopathies. So then thereby the pumping heart is a pump. So the pumping level comes down in diabetics, which is more common than normal individuals. The valves can start leaking again as compared to normal individuals. So that's why you should get your echocardiogram done. It's nothing but a sonography of the heart, very easily done, 5 minutes job, not very expensive, and gives you a great benefit, a great diagnostic level. Also, the next point is a treadmill test. Every year, at least once, you should get this done, irrespective of how much you are walking, because it's a guided protocol. What you do in a treadmill is it's called as a stress test. You put your heart to a physical stress, increase the demand of the heart, and try to see whether the blood supply commensurate with the excessive demand is met or no. So in all, the supply and demand is matched or there is a mismatch. If there is a mismatch, there is a high probability that you this mismatch, that is when the blood demand is increased, the blood supply is not adequately met because of the underlying blockages somewhere in the arteries of the heart. This is what is the attempt to see and pick it up early. This is important. And thereby, the future test, the cardiologist will certainly suggest you, like a coronary angiogram, if a treadmill is positive. If it is negative, your physical activity is assessed, and you are it gives you confidence that you can resume your physical activity as good as you were before. So
Okay.
these
So, yeah. No, thank you, Dr. Porwal. And I think Dr. Porwal very clearly highlights that what are the typical symptoms which one can, uh, which can be expressed in a cardiovascular disease, and he also emphasizes the role of screening and early detection. And you should be meeting up with your cardiologist as well. Sir, one thing very practical I want to ask you here from the patient's point of view. Now, generally, if someone is having diabetes, is in touch with his physician or his diabetologist, and generally, by the time a chest pain occurs, it's already quite late in the day. So what is that appropriate time? Should he go to his cardiologist only when the pain starts happening, or are there some earlier timelines or some compelling symptoms which should take him to the cardiologist for a proper checkup?
to go to a cardiologist for a proper checkup once in a year is as a screening for every diabetics. Now, in spite of that, if he gets some kind of the symptoms which I explained just now, a squeezing pain in the chest, left, right, jaws, interscapular, shoulder blades, or the arms aspects of the arms. He should inform his diabetic that the diabetologist that I am getting this kind of a symptoms, because and he should rush to the nearest cardiologist or a cardiology or cath lab enabled hospital where he can get his basic ECG done. If he is not if he doesn't have an access to a big hospital where cath lab facilities is done, at least get an EC. Identify a place near his workplace or his home or wherever it is, where a basic ECG can be done. The paramount importance is getting an ECG done. The
Okay.
moment that is the first screening test, get an ECG done. However atypical your symptoms is, please do not ignore those. Get an ECG done. That is the first step.
Got it. So, of course, when you have the severe symptoms, you will have to go to a cardiologist or, get an ECG done and then move on. But as he emphasizes, please do meet your cardiologist at least once a year and get your thorough checkup done as well. That is a mandatory, an advice from Dr. Porwal. So now, if a patient, gets this problem, so what are the different treatment in such a situation, which as a cardiologist you adopt? Is it like, you maintain the patients on the medicines? Are there different medicines, or are there, if there are some severe chest pains or symptoms happening, are there any procedures which you generally advise? What's your approach?
So there is no magic pill which can be kept in a pocket like what has been advertised everywhere, and people are making videos that these three pills you keep with yourself. The moment you get these symptoms, pop up these pills and you will abort your heart attack. That is a myth. It doesn't happen like that. There is no magic pill which can be kept in the pocket. First thing, when you get these symptoms, identify a place. As I said, get an ECG done. The moment that ECG is done, with that ECG go to the nearest hospital which can treat heart attacks. Two ways to treat a heart attack. One is, if this patient has a if this person the place or the hospital has the capability to do a angiogram immediately, open up the blocked artery. See, heart attack occurs because of the blockages of the artery. So the our aim is to find out where the blockage is and open up the artery. If it is done within the say first 60 minutes, you might almost abort a heart attack. Heart as a pump can be salvaged. Your pumping effect, your pumping function of the heart can be salvaged, and you can prevent a heart attack or abort a heart attack if you reach the hospital in adequate time, which I say is 60 minutes at the max. Further you delay, time is muscle as far as heart attacks are concerned. So our aim is to reach the hospital as early. If this place or the hospital does not have a on-site angiogram and an angioplasty capability, then there are injections which can be given to burst the clot, and thereafter further angiogram can be planned at a place where this facility is available. So take an ECG, go to the nearest hospital where heart attacks are treated. They will treat you adequately. There is no magic pill or a potli which you can keep in your pocket, thinking or assuming that I have a heart attack and pop it up without the supervision of a doctor. This is I want to emphasize.
Very important, and I'm sure as our viewers listen to Dr. Porwal, so it's important to reach the right uh, hospital which has the facility, and then leave it to your cardiologist, understanding that what is the best medical sort of advice which you may require at that time, or intervention which you may require at that time. So now, once you have done your job and done the required the medical procedures or prescribed the medicines to a patient, now what is a patient's responsibility here? Do they need to change their lifestyles in a particular way, or their nutrition habits or eating habits, to reduce the risk, first of all, in to get such incidents? Or if the incident has happened, then for a faster recovery, what's your guidance there?
Cardiac rehabilitation post an event of a heart attack is of most important, more so in diabetics, because heart attack affects the pumping function of the heart. To optimize your function and your ability as a human being, your physical ability, your emotional ability, and your nutritional function aspects. This so-called cardiac rehabilitation program is as important as the treatment of a heart attack, which is often ignored. So, under the instruction of the cardiologist, with the assistance of a physician who will be a diabetologist, the entire program is designed wherein your rehabilitation or your heart recovery or your heart health is initiated to for you to recover to your pre heart attack levels at the best. Now here, how much exercise you can do, how you can do, and what graded levels you get. Today you have a heart attack, tomorrow you cannot go for a 2 hour walk or something. It has to be a graded system. And the medication what your cardiologist gives you in consultation with your diabetologist or a physician has to be continued indefinitely. I tell all my patients, you leave your food, it's okay, but do not leave your cardiac medication post procedure. After an angioplasty, if you try to live I mean, if you stop medications, cardiac medications, especially the blood thinners, you stand to have a higher chance of reblockages of the stents which have been put in your heart. This is important. So never stop the medicine without the consultation of your cardiologist and without informing your physician. This is of most importance. Now there are certain things what I wanted to tell. See, as I said in my opening remarks, being a diabetic makes you more vulnerable to say blockages, the cholesterol blockages and depositions in most of the arteries of your heart, of the body, which includes brain, eyes, heart, kidney, and the legs. So to prevent this so-called magnification of these blockages from increasing further, and a clot deposition on that, every diabetic who is on HbA1c of more than 7, or his cholesterol's LDL cholesterol is say more than 80 or 80, this person should be on a blood thinner pill along with the statin. This will take him long in trying, and trial studies have proven that this combination goes a long way in preventing this heart attacks. Over to you, Dr. Mehra. Mr. Mehra.
This is, I think, some very important pieces of information which Dr. Porwal is giving to you. Some of these, might sound technical to, our common viewers, but then, if you really pick the essence of it. So what he's saying is that if you have undergone a procedure, then do not stop the medicines which your doctor has, asked you to continue, because it will have a lot of impact on the outcomes. Plus, he has also shared with you the cardiac rehabilitation, which is nothing but how your nutrition has to be, what kind of lifestyle measures you have to be. So talk to your cardiologist that how you have to create the whole recovery path. So one last question I'll ask you, since you're also running out of time. Now, having diabetes and then also picking up a cardiovascular disease and then undergoing some procedure, this has a lot of psychosocial impact as well, and a lot of people have stress issues out of this. They feel that they will never be able to live a healthy life, or there are a lot of myths related to it. So as an expert, what's your advice? What kind of confidence building you can do? Can these patients, if treated properly, can live a long and a healthy life, or is it like genuinely compromised as a lot of people feel?
Diabetes is a lifestyle disease. I wouldn't call it as a disease. Diabetes is a lifestyle alteration. We are moving towards a healthy lifestyle. It is diabetes more so occurs because of our unhealthy lifestyle, sedentary activity, improper food, more of a processed, more of a saturated fats. These aspects are heart healthy. It is healthy food. It's healthy food. It is just not for diabetes. It is for general population, and nothing is permanent. Diabetes is just a taboo. You can live as normal life as any other non-diabetics if you try to wake up, have a disciplined life, irrespective of whether you have a diabetes or no. If you have a diabetes, more so you have to have a healthy lifestyle. I'm not saying compromised lifestyle. It should be a healthy lifestyle which is for everybody across the spectrum. You need not, it does not limit your activity if you maintain a healthy discipline for yourself, which is for yourself. It is a preventive aspect what we are trying to talk here. We are not trying to tell curable. See, nothing is permanent. The moment you have so-called healthy lifestyle, your HbA1c is well controlled. You have now the research has shown, and there is so much of research in this field that with appropriate medications, these plaques or these blockages also come down. This your propensity and your predisposition to develop heart attacks also is minimized by appropriate medication and a healthy lifestyle. This is important. So it is a taboo that diabetics do not live a normal life. They are as normal as any other normal individual, provided they have a good discipline, healthy lifestyle, which is most important.
Okay, so which means that it's an assurance from Dr. Porwal that if you maintain a healthy lifestyle, if you take care of your doctor's advice, then I think you can maintain a good quality of life over a long period of time. But then, if you don't take care of those things, of course, then there can be problems on the way. So I must thank you here. I think a person of your expertise coming over and I asked you some of the very, very basic questions from the patient's point of view so that our common viewers can be more wiser with your advice. So I must thank you for joining us today. I
Thank
also
you,
must
Mr.
thank,
Nada.
yeah,
Yeah.
and I also
We
must
try to
thank
talk
all,
as a Mitra on the Heart program. Mitra of the
yes,
Heart. The essence of
and
Heart Mitra is being a Mitra of the Heart.
exactly so. And today you have proven to be the mitra of a lot of people who would be hearing you and watching you. I must thank people who watched us today live or who would be watching this program later on as well. If you have anyone in your family or friend circle who has diabetes or who has cardiovascular disease, you can simply share the link of this program with them. And the advice today given by Dr. Porwal can be very useful and helpful for them. With this, I must thank you all. If you have such symptoms or issues, and if you live somewhere in Karnataka or Maharashtra, you can always go to Belgaum and meet Dr. Porwal. He will be happy to help you. If you are listening to this program anywhere in some other city and you get symptoms which he shared, immediately reach out to the nearest cardiologist and seek help. Thank you so very much, and good night, everyone. Dr.
Thank
Porwal,
you.
goodbye.
Thank you, everybody, to all Heart Mitras as well. Thank you. Have a nice evening. Bye.
Good night.